What's going on, everyone? Happy Friday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Friday edition of the Pandemic Update for Friday, August 9th, 2024. If you're new to my channel, welcome to my channel. You just clicked on to today's pandemic update on all things COVID and any other virus that could be a health threat to you. Let's face it, there's a lot of viruses out there, but there's not a lot of news coverage of these viruses. That's where I come into play. I do some research, I find various different things to show in these videos each and every day, and then I report them to you. And as you can see here, we're going to be starting off talking about the Olympics today, and we got a lot of other things. There are a lot of tabs on my screen today that we have to get through because it's Friday. CDC updates some data on Fridays, but unfortunately, as of the time of this recording, there is no New York State for today. Of course, as you know, we will refresh it again when we get to that point, and what do you say we get into it? But first off, if you're new, subscribe down below, give this a thumbs up, hit that notification bell, share these videos with anyone you know, because the more people we keep informed, the better, and leave your comments down below. Alright, starting off with the Olympics. This occurred yesterday, or the news came out yesterday while we were doing yesterday's pandemic update, which is why we did not get to this yesterday. Very bad. Noah Lyles ran Olympic 200-meter final with COVID. Yeah, this is totally ridiculous. And he needed a wheelchair after the bronze medal. Yeah, apparently he did it while he was positive. He was sick, and yeah, he needed help getting off of the track because, he's sick with COVID. And I don't think this should be a thing. If you have COVID, you should not be allowed to compete in the Olympics. And let me tell you, there's a lot of people that agree with that. I put a poll out yesterday. It was rather late. I should have done it earlier in the evening, but I decided to do it 11:39 at night. Hey, we still got 563 votes. Do you think athletes who test positive for COVID should be allowed to compete in the Olympics? 3.9% said yes. 96.1% said no, and I think it went pretty much as it should have gone. I think that's exactly what people would expect. No would be the winner for that because it's ridiculous. Number one, you're infecting other people. Number two, you could risk your health. I mean, these athletes who are competing while positive, they're increasing their chances of going on to develop long COVID after COVID. And there was another athlete, I don't have it up on the screen, but there was another athlete that had to be taken off in a wheelchair because they collapsed. And it turned out they had COVID 2 months before. That one as well will also make it into the archives on my website eventually. It's been a very busy summer wave, and I'm still trying to play catch up on that. I add about 2 to 3 positive cases a day, and seems as if that's not good enough. Alright, anywho, take a look at this. This, I believe, is for Ireland, which reports 81 measles cases this year and 13 outbreaks confirmed in Ireland so far. This is not good, and the outbreaks occurred in private households, schools, or residential institutions within a community. So, yes, the number of measles cases are up. It does also say here 38 of them are males, 40 of them are females, and the gender was not recorded for 3 cases. Moving on, more measles news. Oregon. We've been talking about this several times. Well, Oregon, your measles outbreak has grown to 25 cases in 3 counties. So, yes, it's continuing to be a problem in Oregon as well. All right, now to a couple performer or entertainment notes. Rod Stewart cancels 200th Las Vegas residency show due to illness, and he says, "I'm desperately sorry." And that illness is strep throat. So he did come down with strep throat. That's not good. Then moving on. Blink-182, the popular band from the 90s and early 2000s. Blink-182 cancels Friday's concert in Kansas City, show citing illness. And I do believe he also canceled a show in St. Louis as well. Yes, 2 of them. And that's simply because they are dealing with an illness at this time. They can't state what the illness is, contract purposes, insurance purposes. There's a lot of reasons, but they're dealing with an illness. Maybe down the line we will find out what it was. All right, this is coming from X, Twitter, and I thought this was really interesting. I got tagged to be shown this, and this is really interesting. Sci-Fi put, CDC update. Influenza-like illness, ILI, activity is 101% higher now than 2019. Broken down to age groups, we see 65 plus. 185% worse than 2019. 50 to 64 years old. 173% worse than 2019. 25 to 49 years old. 145% worse than 2019. 5 to 24 years old. 86% worse than 2019. And just 0 to 4 years old. 37% worse than 2019. Influenza-like illness can be used as a proxy, early indicator of future long COVID, ME, CFS, and death age group charts to follow in this thread. I mean, this is just insanity. And one of the big things that's causing for there to be more illness is people are getting sick easier because COVID can do damage to your immune system. And take a look here. When did this start? 2019. COVID-19. I mean, this is just insanity that we are allowing this to happen. All right, want to show you something on the website. No, not this annoying ad that pops up. Yeah, I'm going to be working to fix the ads that just pop up on your screen. I'm not liking that. I'm going to get in Google AdSense and try and do away with that. Alrighty, we've added something new here. It's going to be a work in process. I probably won't get to work on it till sometime. You may see some things pop up in it this weekend. Celebrities and famous people who have died from COVID. I know there's at least one, maybe more, that are already within the archives, and I think it's time we do this. We have a dedicated spot for celebrities who we know have died from a confirmed case of COVID. Not because, well, we know he had COVID and then he had such and such. It must be, no. Has to be a confirmed source, and if we click on this, article or this thread that I did put in there that will be pinned, there are rules for posting this, and it's fairly simple, but I'm going to be pretty strict about this. It needs to be a confirmed source, like a news article or maybe a relative of the celebrity who died, like the one that's coming to my mind. I know it's in the archive, David Crosby. His wife went on to say, yes, he did suffer from long COVID. So there you go. That will make the list. It was because he had COVID. Get where I'm coming from here? And I think this list is going to grow pretty big. I've seen in my searches, I've come across quite a few that I will be eventually adding. It's going to happen when this summer surge ever ends, because as you can see here, look how much stuff I'm posting a day. It's silly right now. Hopefully this slows down relatively soon. Moving on now to the national allergy map for today. 33% of the country is in medium status, and unfortunately, take a look at this. Indiana, Ohio, portions of Michigan down near Detroit. Red is starting to show up, so yeah, it might be a good time to take your allergy medicine once again if you live in those areas. Moving on now to air qualities, and taking a look at air qualities across the country. The east is really not doing terrible because, well, it's raining across portions of the Mid-Atlantic into Northeast. That front is clearing out. It's a front caused by former tropical depression Debbie, and Great Lakes are doing good. Pacific Northwest continues to have the wildfire issue, which is why there is still a lot of red and orange showing up. Going back real quickly to my website, forgot to tell you this. If you've never seen my website, it is datareport.info. That's where you can find my website. Alright, want to learn about all things climate or weather? I got another place where I talk about that. That's over on X, and it is Climate Data Report. I will be doing some tweeting on that later today. Philadelphia, good news. 775 EMS incidents were reported on Thursday, August 8th, finally below 800. I hope that stays the case for today, but it's hard to say. The Philadelphia suburbs, Montgomery and Chester County, earlier today, I had to do a tweet about it, were very busy. Take a look at these lists here. This first one was Chester County. This was Montgomery County earlier. Yeah, it was a full house. And you notice here, in Montgomery County, there were a lot of injury-type calls. I mean, still, the point is, they were just very busy today. Let's do a live look in. I'm seeing respiratory emergency twice. I'm seeing, whoa, not one, not two, 3 strokes right now in Montgomery County. Well, that's not good. And we do know there can be post-COVID blood clots and stuff like that. Remember Al Rooker? Yeah, that's not good to see. There's a stroke in Chester County right now in Pennsylvania. So yeah, it continues to be a busy day. Right now it's not as busy, but sometimes it's the type of calls. And seeing all these stroke calls, that is just not a good thing whatsoever. Walgreens this week reports 40.2% positivity rate. The prior week was 39.4%. That's a difference of up 0.7%. And they did crack 10,000 tests. 10,596 tests with 8,132 tests the prior week. I don't know. Will testing go even higher? I think it's going to start to come down pretty soon because we're coming very close to the peak of this summer surge. And you'll see some indicators today actually already have potentially peaked, but wastewater, which we're going to take a look at that as well. Wastewater is still rising in the United States. The viral activity level of COVID-19 in Canada right now is moderate, and that's the level it's been all week. Flu A, flu B, and RSV is low at this time. Alrighty, let's take a look at some new data that just came in today, and this is for the United States. Nationally, the wastewater viral activity level for COVID-19 is currently very high. So we crossed over to very high levels of COVID-19 in the wastewater in the United States. And you can see here, yes, this chart, it's literally going straight up at this point. So that's not good. And you can see I was fiddling around taking a look at some of the wastewater sites earlier. You know what, let's refresh this so you can see the national levels. I was looking at New York State earlier. And a lot of the western New York State is still going up despite what the dashboard for New York State shows. Western New York State was still rising. That's what I want to see, but we won't be looking at New York City on this because anything gray did not update. All right, take a look at this. News sites, 50. Then you come to this number, which this is not a good number whatsoever. And that is the number of low sites. 0 to 19% COVID detected. These dark blue sites. You don't see many of them because there's only 36 around the country. And then you see the lighter shade of blue, there's 113 of them. Then you come down here to the real light shade of blue, that's like moderate COVID levels, 299. Orange, moderate to high, 60 to 79% COVID increase detected. 428 sites like that. Red, 80 to 100% COVID detected. 309 of them detected. Folks, I think this is worse than last summer. I don't remember there being so few dark blue sites last summer. This is just absolutely crazy. And if I wanted to, I could probably go back and look at last summer's video just to see what these numbers were. I don't recall it ever getting to this point. And we're probably coming near the peak of this right now. I mean, with it rising, I'm going to show you that chart again. Look how fast it's rising. You can see in the majority of the COVID waves since they started this, when it starts rising that fast, look what happens. It starts to drop. Now, in some cases, it dropped and then would go up again. And it's done that a few times. I would think, with how fast it's rising right now, we're probably 1 to 2 weeks away, if not sooner, from seeing the national level starting to drop. Let's continue on to some more data. And this is not good. This is when you average all the wastewater sites in an individual state. Texas still comes in at very high. Alaska, very high. Hawaii level comes in at high. California, very high. Oregon, very high. Washington, very high. You get the point. Pennsylvania is now coming in at high when you average out 33 wastewater sites reporting. New York State is moderate. New York State never did get to high levels on this, which was rather interesting because New York State was rising for multiple months and has now peaked for their summer surge, at least on a statewide level. Wastewater would show you different things in western New York. We'll get to that on Sunday, but we are going to take a look at a couple wastewater sites today in just a moment. Taking a look at epidemic status, we can see it is growing across portions of Vermont, New Hampshire, Massachusetts. Maine is still likely growing, but it is likely declining now in Connecticut, which is a good thing. New York State, Pennsylvania, New Jersey, Delaware, stable or uncertain, and a lot of southeast states are still growing at this point. We do see conditions are declining now across Nevada, likely declining now across portions of Hawaii, California, Arizona, Montana, North Dakota, Washington, even Kansas are still growing at this point, and Alaska is uncertain. There's still a lot of states that are uncertain. It's still growing in Ohio. It's also growing in Arkansas as well. Likely growing in Illinois. Likely growing in Iowa, Texas, Louisiana, Oklahoma, South Dakota, Nebraska, Idaho, and Oregon are still likely growing at this point. Maryland is also still in the likely growing stage, and we do know Maryland reported an increase in COVID cases this week. The latest variant, now this did not update today, but it is the KP.3.1.1 variant at 27.8%. KP.3 is at 20.1% this week. Moving on now. Here's some really good news. We're just going to take a look at the national level of emergency department visits for people diagnosed with COVID. We'll take a look state by state for all the states that did report in tomorrow's update. And you can see here, it may have finally peaked at 2.08%. We'll have to watch this. It does look like it's starting to drop. Who knows? It could drop rather quickly. We'll have to just watch what happens there. All right, let's take a look at some wastewater data, and I do need to refresh this. There are some wastewater sites that I want to show you today. And no, we don't want to see New York. We looked at that one yesterday, but I do want to show you Newark, New Jersey. I thought this was rather interesting because I looked at it earlier, and take a look real closely. You can actually see here, it's starting to rise once again in Newark, New Jersey. That is a little bit concerning, considering they were slightly elevated for the majority of the summer. Then they were starting to drop back in July. And then at the start of August, you can see here, they're starting to see a rise once again. It just goes to show you, state by state, town by town, can really vary with COVID. Let's go to one more wastewater site. How about we come out here to near Denver, Colorado. We'll go to North Parker, Colorado, and see what's happening there. And oh my, take a look at this. And you can see a little wonky movement, but the overall trend continues to be up at this wastewater site in Parker, Colorado, which is not terribly far from the Denver area, so that is concerning. Taking a look at New Jersey for today, they reported 535 hospitalizations, 12 people on a ventilator, in the ICU at this time, 48 discharges, 91 discharges today. That's a lot of people that have been discharged in the last 24 hours. That's a good number. This is 69 out of 70 hospitals reporting. Drum roll, please. I've been refreshing this all day. Hopefully we got something out of New York State, and we did. I'm very happy to report that New York State reports 2,041 new cases. That's a number that does continue to drop. That is some good news. Let's take a look at New York State hospitalizations. Bear with me. I'm just refreshing this. They were very late today. And we can see New York State hospitalizations, 1,180 people in the hospital, 106 people in the ICU. And I do want to quickly take a look at Western New York. Western New York, after a quick rise, is now seeing just as fast as a drop. How about Long Island? What's going on there? Long Island is dropping at this time. 207 people in the hospital, 17 people in the ICU. And New York City, I hope I can report New York City's starting to drop. They are starting to drop some. 473 people in the hospital and 46 people in the ICU. All right, taking a look at the update from LA this week, we can see hospitalizations, they have leveled off and dropped slightly. Cases are starting to drop some. For whatever reason, the positivity rate has not dropped yet. It's at 14.61%. That continued to rise. I think that's going to be dropping pretty soon. Emergency department visits and wastewater, well, according to this, it's still going up, but if you take a look real closely, it doesn't look like it's actually updated. And drumroll, please. We need to see if California updated, because I've been trying to refresh this the majority of the day and have been coming up blank. And nope, it's still, okay, here we go. Yes, it did. Whoa. Yeah, I'm not liking this. Here's the COVID positivity test rate. California should have been peaking. They're not. What's going on here? Wow. Positivity rate just shot up to 14.3%. Now, there could be a reason for this. San Diego does report, I believe, monthly. Correct me if I'm wrong down below. That could be one of the reasons why the positivity rate shot up so much, but okay, it's 14.3% positivity rate in California this week, up by 2.3%. And taking a look at COVID deaths, they're up 0.3%. Again, I'm going to stress, when you start to see rises this fast, you start thinking, okay, it's going to peak pretty soon, and we'll see. Maybe next week it will, but this week, California reports a big positivity rate increase, and a slight one for influenza as well. 1.4% test positivity rate, that's up by 0.2%. Influenza deaths down, and COVID-19 deaths in California, they're up slightly this week by 0.3%. 1.8% of deaths are due to COVID-19. Again, there has been some lagged reporting in some parts of California. Alrighty, folks, that does it for the Friday edition of the Pandemic Update. We will have another update again tomorrow. We'll take a look at ER visits and whatever other news pops up. Hit that thumbs up button if you like this video. Hit that notification bell. Subscribe down below if you're new here. Share these videos with anyone you know, and leave your comments down below. Hey, look at that. We went over 20 minutes today. Oops, but you know what? It was a busy news day. I'll see you all again next time. Until I see you again next time, stay safe, everyone. Have a fantastic Friday evening. And if you don't catch my updates this weekend, have a fantastic but safe weekend. Thanks for watching.